Topic is Beyond the Lacrimal Sac, Story of Misleading Medial Canthal Swellings. Anatomy of the medial canthus is complex, and due to its structural variability, various types of lesions can arise from this region. Dacryocystitis, being most common, is bit overdiagnosed. Classically, the swelling is below the attachment of medial canthal tendon. So, aim of the study is to analyze the etiopathogenesis of conditions masquerading as dacryocystitis presented to a tertiary eye care center. It's a retrospective interventional case series. Study period was 2021 January to 2023 June. Cases referred as dacryocystitis, but turned out to be other conditions were included in the study. Syringing, probing, imaging, and surgery were done as and when necessary. Total patients were 10, and mean age was 44.2. Chief complaint was only swelling in 7 patients, swelling plus discharge in 1 patient, and only discharge in 2 patients. 8 were referred by ophthalmologists and 2 by other specialties of medicine. Syringing was done, which was patent in 5 cases, partially free in 2, blocked in 1. These are the distributions of various conditions in this series. This girl presented with a swelling right eye 2 weeks duration, but syringing was partially free, and we did an imaging which showed a mass in the sac area. Surgery was done, and it was a high-grade lymphoma. She was referred to an oncologist, and timely referral could deliver proper management to her. Second case was a large fungating mass pushing the glove laterally, and he gave history of TCR few months back. CT orbit showed a mass in the lacrimal sac area. Surgery was done, and it was well differentiated squamous cell carcinoma of the lacrimal sac, which was locally invasive, and further management was done by surgical oncologist. So in case of suspected sac malignancy, TCR should be avoided to prevent local recurrence. And in this case, consistency and extension beyond the MCT was suspicious. This lady presented with a mass gradually increasing in size. Site is corresponding to the lacrimal sac, but syringing was free. And upon exploration, it was an infected cyst wall lined with respiratory mucosa, no connection with the sac. This patient had a mass well below the site of sac area, but it was referred for DCR. Syringing was free, and upon excision, it is a well encapsulated mass, pleomorphic adenoma of ectopic lacrimal gland, which is a very rare condition, and success depends on the complete removal, which was possible in this case. This patient gave a history of blood stain watering, 1 year duration. Syringing was patent, and there was a mass also. And sac, there is on imaging, there was a patchy filling of the sac, and nasal endoscopy was done, and we could see rhinosporodial spores. So it was a case of nasal rhinosporidiosis extending to the lacrimal excretory system, which was very common in our locality, who takes pond water bathing, that is stagnant water bathing. This patient again presented as a swelling, tender swelling extending up to the medial end of the eyebrow, and you can see some pustules over there. It was infected hair follicles, furuncle, and he responded well to systemic antibiotics. These 2 cases, watering and discharge from both from the left eye, referred for DCR, and slit line evaluation showed pouting punctum and a mass in the inferior canaliculus. On expression, we could see concretions. So these were cases of canaliculitis which requires canaliculotomy. These 2 patients, they presented with periorbital edema, and edema subsided with anti-inflammatory measures, but there was a mass which on excision turned out to be parasitic mass, dirophilaria, nematodal mass. So recently, this sort of presentation is increasing due to environmental changes, global warming, which can be attributed, which increase in the vector population, that is mosquito is the vector of this condition. So in this study, I described 8 different conditions. The correct diagnosis was available only after pathology report in some conditions. So high degree of suspicion is necessary in atypical cases. Atypical features in my study was mass extending beyond the medial canthal tendon attachment, globe displacement, bloody tears, patency on syringing, pouting punctum with concretions in the canaliculus. So, this study, we could, there is, according to the geographical distribution, there is difference in the pathological conditions. So, this study highlights our findings from our region, which includes mass lesions, infections, and infections. So to conclude, this study highlights the importance of meticulous clinical examination and appropriate investigations, awareness of common clinical conditions in the study population so that you can counsel your patient preoperatively and avoid further disagreements. Limitation is small sample size. Thank you.
All your patients, syringing is better.
No, 5 cases only syringing was fully free. 2 cases it was partially free.
That case
One
is
was blocked.
quite obvious. You never suspect lateral.
Yeah, but I present cases referred to me as lacrimal status. Yes. So proper clinical evaluation is necessary to get the correct diagnosis.
Even one cases you had syringing is obstructed.
Syringing is obstructed. That was a sac carcinoma.
The partial or complete?
It was complete, sir.
Complete.
Nice series of cases, ma'am. And you said the sample size is less, but these are rare cases, right? So sample will not be that much, but still you can publish this by making it as a series of all the patients that were screened for lacrimal sac masses or canthal masses, and these were the atypical variant. The sample size will go up in that way.
Sure.
Or else maybe 1 year study of all the masses presenting and how many of them were masquerading. You can present like that. But nice series, very nice cases and very nice recording, case record maintenance.
Thank you.
Thank you, ma'am.
So, sir, very original and very nice. Did you pre-treat any of these patients when they were referred to you, or was the diagnosis made immediately as you saw them?
Few cases I could make out immediately, but some I had to wait for the pathology report because first case I didn't suspect a lymphoma, but it was a surprise to me.
And then you said they were referred as lacrimal cystitis, correct? And then
Lacrimal sac mass for
masses,
DCR,
yeah,
like that it was
some of
referred.
them had perioperative swelling edema as well. So did you put, I mean, were they all treated with antibiotics?
Actually, the treating physician, I mean, some were taking already on.